Congo be contained? We'll look at how health workers are trying to prevent the spread of the deadly disease.
And if you're in a country that's been affected by Ebola, we'd like to hear about your experiences. Let us know via Twitter or in our live YouTube chat.
Hi, I'm Nicole Facina, the IFRC Ebola Operations Coordinator, and you are in the stream.
The nearly year-long Ebola outbreak in the Democratic Republic of the Congo has now been declared an international health emergency by the World Health Organization. The designation was made after the virus was detected last week in the country's largest city, Goma. Over 2,500 people have been infected and more than 1,700 have died since August, making it the second deadliest Ebola epidemic on record. Fever checks have been stepped up at the borders, and in eastern parts of the country, efforts to stop Ebola's spread have been complicated by violence from armed groups and conspiracy theories that have hindered public health outreach. Treatment facilities have also endured violent attacks from locals, frightened that health workers are responsible for spreading the disease.
So how can Ebola be contained? Well, with us to talk about these issues in Kinshasa, Dr. Subwe Mulangu, a senior lecturer at the University Hospital of Kinshasa. In Yaoundé, Cameroon, Yap Boom with Epicenter Africa, which is the research arm of Doctors Without Borders. And in Kigali, Rwanda, George Kalisa, an editor with Light Magazine. Welcome to the stream, everyone.
Good to see you, gentlemen. There's something I have to show you. Yap in particular, I want to show you this. Have a look on my laptop. This is from Helen Branswell. She writes about infectious diseases. And she starts here. Another health worker in DRC has been infected with Ebola, the 138th of this outbreak. And then let me just show you here, 138 contaminated health workers. Yap, how is it possible with Ebola in the DRC, that is a known infectious disease, with the West Africa crisis from several years ago with Ebola, that a single health worker this deep into this current outbreak would be infected with Ebola? Because if health workers have been infected, what hope do regular people have?
Oh, that's a great question. When we ended the outbreak in West Africa, we say never, ever again. But today we are really challenged, and the healthcare workers are the first-line people. So whenever you have a suspected case, they will go and see the healthcare workers. And those people, at that point, especially in a rural and remote part in North Kivu, they won't have all the protection. They won't have gloves. They won't have all what is needed to actually protect themselves. That's one. And secondly, Ebola the symptom might be like malaria and many others. So it's very difficult for them to figure out that this patient which is coming might have Ebola. So that's a real challenge.
But even today, I get that at the beginning, because you're not even sure what it is at the beginning. But this deep into the Ebola crisis in the DRC that have had many Ebola crisis, how would it be possible that even in rural areas that the health workers are not ready?
Yes, when you say that, you make the assumption that the health facility is connected to internet, to TV, to radio, and so on. That's not right. You have some places where you have no power, no electricity. So those people are not that connected. So when the Ebola outbreak arrived, they are shocked and surprised. So before they realize, they contract the disease. And because of the conflict, some of them have not aware of what is happening.
And that is a perfect answer for this question here. Diana Horton on YouTube is asking, why does this keep happening? So I heard your perspective there, Yap. I'll give this one to you, Dr. Subwe, because of course people outside of this region are still wondering why we're seeing the numbers like we're seeing today. What's your take on that, Doctor?
Yes, I agree with what Yap says about the condition of the health facilities in that region. But what I would like to add is that this Ebola crisis occur in economic crisis. That means that the health facilities that don't have all the means to control infection, so they don't have running waters, they don't have protection, they don't have all basic things that helps hospital to control infection. And what happened when the level of hygiene in hospital is not high, contamination occurs. So that's just the reflect. Ebola is just a reflect that the health system need to be improved, and we have seen that in previous outbreak. As long as the cases are in the community, the outbreak tend to stop by itself. As soon as it's reached a hospital where the level of hygiene is not great, so it starts to spread. The hospital play a role like an amplification of the outbreak. So I think Ebola is a crisis inside economic crisis. Over to you.
George, let me just bring you into this conversation because during this current Ebola crisis, there have been attacks on healthcare workers and attacks on healthcare centres. I'm going to play you this little clip because one happened just recently. This is Nelson Paluku, who is a health centre manager, and his health centre was burned down recently. This is what he had to say about it. Have a listen.
As you can see, bandits came to burn the center for sorting Ebola cases. We were getting a lot of sick people. This whole community was coming to get treatment here. 20 to 25 patients a day. Let the government ensure the safety of its health workers. The authority of the state must be restored in this environment that is beyond the control of the government.
George, you're reporting on this Ebola crisis. Can you give us some insight into why healthcare centres would be burned down? Can you explain that?
Yeah, the world, the international community has to know this, that even before Ebola came, the Democratic Republic of Congo was already prey to militias, to militia groups who have been fighting for a long time. And when Ebola came, it found a very, very weak ground whereby even the political leadership had already been weakened, especially in this region of the eastern region of Congo by the militias. For example, the Allied forces, these ADF and the Mai Mai, and several militias who are in this area, especially Butembo, Beni, and Ituri. So the government, much as the political will has been there, but these militias has made it very difficult for government to make quick responses in order to arrest the situation of Ebola outbreak.
The militias, of course, are not making it easy, but in addition to that, we're seeing people online say that there's also just a general fear, mistrust, and a lack of understanding on what's going on. So this is a comment we got from someone on YouTube Live. Donald says, the area is remote. In most cases, superstitious people handle the dead. They think healthcare workers are the cause and not the problem. Many of these areas are war-torn, talking about the conflict you were mentioning there, George. But yeah, talk to us about the threat that some health workers are facing because of the issues that the person here in this YouTube comment mentioned.
Yes, one point to also add is that the presidential election has been postponed in those three areas. So therefore, the community have felt that the government has stolen the election and took advantage of Ebola. Therefore, what's happened? There is no trust. So they consider that the health workers are part of the government somehow. So therefore, they will attack them. And we lost one Cameroonian epidemiologist, Dr. Richard, and many others who lost their life.
I'm just thinking about this issue about how much do people know about Ebola. I'm thinking if you have experience, if you know anything about the disease, you're going to be in the DRC, but not so. For me, one of the biggest issues is education and spreading the word. This is the former DRC's health minister explaining exactly what the problem is with the current Ebola crisis. Have a listen to what he had to say.
I
would also like to remind you that the case of Goma is linked to a pastor and that the case of Uganda is also a family of a pastor. The pastor had died because he also refused to get treatment. He continued to do the practice of laying of hands. He died of Ebola and then contaminated his family.
Aux conclusions du comité des experts, Ebola est une réalité.
Ebola is a reality. Ebola is not supernatural. Ebola is not paranormal. Ebola is a disease that is caused by a virus. It is a disease that is curable when patients are treated very early.
Yap, I see you nodding there. It seems so obvious to us who have got to grips with what stops Ebola from spreading, but that's a former health minister trying to explain to the country what Ebola is.
Maybe let me tell you quickly a short story. I was in Itipo, that was last year when the outbreak started in the Equator. And we were setting up the vaccine site. And I was talking with one of the survivors, trying to figure out who are the people that has been in contact with him. And at that time, he started pointing me different people who were working with us as we were setting the camp. And at that point, we just realized that those people were not aware of what was happening. Those people were actually all in danger, and we were as well in danger because we didn't know. They have not been followed up. So we can imagine that there might be a radio, internet, and so on, but definitely those people, where they are in a remote place, they have no idea of what Ebola is for some of them. So it's a huge work that is being done to educate the population, raise awareness, and engage them.
And of course, complicating the story even further was this news that came out this week. Just on Monday, DRC's health minister, who you just saw in that clip there, quits over government handling of Ebola. He stepped down after the president's office took charge of the DR Congo's deadly Ebola epidemic. He tweeted out his resignation letter, and in that tweet, he also mentioned this, which I've highlighted here because people in our community are picking up on it. He says it would be fanciful to think that a new vaccine proposed by actors who have shown an obvious lack of ethics by voluntarily hiding information from medical authorities could have a significant impact on the control of the current outbreak. So, Dr. Sobwe, I'd like to talk about that vaccine because this from Albert on Twitter. Here's his take. He says, given the minister's explanation, it appears that there are ethical and practical concerns that those advocating for a new vaccine should address. A new vaccine would hurt lives, are at risk, and the vaccine currently used can't be trusted. So talk to us about the two vaccines at issue here. Dr. Sobwe?
Yes. So, yes. Regarding the vaccine, I think that currently there is one vaccine that have been used, and since the last outbreak in Equator, is the VSV vaccine, and from the Merck company. So this vaccine is experimental vaccine, is not licensed yet. It have been used in the West Africa outbreak, also in Equator outbreak, and now in North Kivu. And this is a recommendation from WHO. So recently, so there has been discussion about the introduction of a second vaccine, and I guess WHO, the advisor group from WHO meet, I think, in July. And the recommendation was like this. So they recommend to continue to use the current vaccine, the VSV vaccine, for the contact, and also from the frontline healthcare workers. So this is the first recommendation. And also, they also say that they are open to test a second vaccine, but out of the zone of the current outbreak. That was the recommendation.
So in your view, how effective are these vaccines? What do we know about them? The Johnson & Johnson one, which is the new one, and the Merck one? So
for the first one, there is, I think, a record track data of the VSV vaccine.
So Dr. Sobwe, I'm just imagining yes. that I live in Eastern DRC, and all I want to know is, will it save my life?
Right.
Well, can you tell me that?
Yeah.
Which vaccine should I ask for, and will it save my life? That's all I care about. That's all I care about. Yeah.
Yes.
That's all I care about. People are dying around me. My health workers are dying. I just want to know, is it going to save my life? Doctor.
Let me just take you back to West Africa when we were using the Merck vaccine.
Right.
And
nobody's saying yes to me. That's scary. You're taking me back to West Africa, which was the worst Ebola outbreak on record. All right.
And that's the only one that gave evidence that this vaccine has some efficacy. So if we did not use that at that time, we would not have that today.
Right.
So why not try the second one as well?
Why not indeed? What's the debate?
That's the question. I think Dr. Oli has some concern, which he has raised, and I guess the WHO and us as well, if it's not involved in the trial, and ENRB will provide the evidence that this is a trial, and we are aiming to provide vaccine.
Right. So maybe we've touched upon something here, and our online community have touched upon something here, that there is a real debate and a fight going on behind the scenes. George, what do you know about this?
Yeah, behind the scenes is that there is some kind of distrust now developing because people are confused after a full health minister is trying to side with the previous vaccine. It is a lot of, like he said, it is confusing. And apart from that, the local communities here, the folks, have got a tendency, a mentality, because this has happened for decades. Congo has seen so many people from the West coming and, I will not use the word steal, but sort of, they come interested in the resources of Congo, like gold. So the local folk also think that maybe there is an agenda to take their land through the Ebola outbreak so that they can somehow plunder the resources of Congo like they have done for decades since Congo was liberated, even before that. And when you look at the ordinary person may not understand the whole idea about this vaccine, the other vaccine, and now that the minister himself came out to disagree with the two vaccines, that one may not actually cause a solution in terms of the mentality of the local people, but also worsen the understanding of vaccination at large.
And George, I'm glad that you mentioned the ordinary person, your average person, because we got a video comment from someone who says it's because of those average people, your everyday people, that we need more than just a medical response. We need more of a human-to-human response. So this is a comment we got from Anne Marie Connor of she's a national director of the charity World Vision International, and here's what she told the stream.
A year on into the Ebola crisis in eastern DRC, myths, misinformation, and fear continue. A medical response is not enough. Informal leaders, like pastors, imams, and priests, are essential to the fight against Ebola. They are respected leaders in their community and have the ear of their communities. We must equip them with the right information so that they can share it with their communities, and each of these individuals can stop the chain of transmission.
So, Yap, she's saying this is more than a medical response that we need. What do you make of that?
It's more than that, much more than that. And beyond that, Kalisa mentioned there is a zone of conflict. So it will be hard to solve the Ebola outbreak if we don't solve the conflict that is behind. So because those people who are fighting are not going to accept the response team to support him when they believe that they're coming from the people who they are fighting. So they need a political engagement more than what we have so far. There is no way a technical solution will solve that wicked problem.
I want to show our audience, just to remind us where the DRC is, and then also to look at where the areas that are most at risk happen to be. So let's start with the map. Let's start with the epicenter of the Ebola crisis. We're going to put that up on TV so you can see it. There you go. Beni, North Kivu province is the epicenter. Let me show you how many cases to date that we have seen of Ebola and also the number of deaths as well. In the dark orange you're about to see, these are the countries that are at highest risk of Ebola getting outside of the DRC. It already travelled into Uganda, but that was from a family who had been in the DRC. And then let me show you in the paler orange areas, areas that are at risk but at a lesser risk. I am just wondering, Doctor, what a global health emergency for the DRC Ebola crisis, what does that do that changes that map, those areas at risk right now? Doctor, go ahead.
Yes, this is Subway. So I think that the map will not change. So the situation before the declaration and after the declaration is not changing. The things is changing now is the awareness that now we had a case in Goma. So the risk of the spread of the disease increase. So the disease to cross the border and to become an international concern. So, but in the ground, in DRC, the activity, the response activity will continue. The pillar of the response activity will continue. But in the international level, there will be more engagement of government to bring more resources to control the outbreak in DRC. And the neighboring country, they have the same risk related to the people who travel across the border to those countries. So I guess the map is still the same, but now the awareness is just increasing, and now we need to put more effort to end the outbreak where is started.
Someone on Twitter, this is Lloyd, who picks up on what you're saying there and says that this declaration does not release any more funds for the WHO, but what it does do is ensure that the world knows that the outbreak of such a severity is to warrant that classification. There's so much that needs to be done in such a short space of time, but when it comes to what more needs to be done, as he mentioned there, we got a video comment from someone in Durban, South Africa, and he calls for a pan-African approach. Have a listen.
I would like to see ministers of health from across the Southern African Development Community work in partnership with the African Center for Disease Control to mobilize resources and to provide technical assistance to the Ministry of Health of the DRC so that we can ensure that human rights and the right to health is at the center of all prevention and risk mitigation efforts, and to express regional solidarity at a time of tremendous crisis for the people of the DRC. It's a time for us to pull together and a time for us to work together as Africans.
So Yap Levi there is calling for an African response. What do you think?
Yes, actually, the African Union has made a declaration, I think, 2 days ago. They've already called their Peace and Security Council so that they can be a part of the response, and also the volunteer. But I want to go beyond African, Pan-African within the continent. I mean, we have also all the African diaspora. They can also find a way to support, either technically or financially. We have the philanthropists. We have Dangote and quite a number of those big people who have supported in West Africa. I think it's time also, an opportunity for Africa to solve this issue that might go in all our continent.
All right. Thank you so much, gentlemen. It's been really interesting hearing the context with which you are working right now and trying to share the information about what is happening in the eastern part of DRC, particularly with the Ebola crisis. As we've been live right now, Malika, what have you been finding from our online audience?
I will end with this tweet from Howard, who says, hopefully lessons can be learned from experiences in Liberia and Sierra Leone, where local institutions, including religious actors, played essential roles in overcoming stigma and misinformation in communities that are tackling Ebola.
Malika and I will always see you online. We're at ajstream on Twitter. See you next time. Thanks for watching.